people who have some kind of a symptoms like flu-like symptoms should avoid going to these gatherings. Whether it's HMPV, whether it's COVID, because COVID is also there. It's not that COVID has disappeared. For HMPV, there is no vaccine as yet, and there is no treatment of the virus itself, and there is no recommended antiviral therapy for this virus.
Human Metapneumovirus, HMPV. This is a name that many have now become aware of. And as soon as there have been cases found in India also, the precautionary measures are on. The states are making all the preparedness so as to counter the situation, not to spread panic, but to spread awareness. And to add to that further, today we are joined by Dr. M.C. Misra. He's the former director of All India Institute of Medical Sciences, AIMS in New Delhi. Dr. Misra, thank you so much for speaking to One India.
Thank you so much, Pankajji, for inviting me for this discussion on human metapneumovirus,
Yes, sir.
Popularly known as HMPV, as you have mentioned. So that has recently generated a lot of interest in the media in India, following the upsurge, or I would say the cluster of cases detected in China, one of the regions of China. And that has naturally pressed a panic button around the globe, and also India, which is not misplaced, because we कहते हैं ना, दूध का जला हुआ जो है वो छाछ भी फूंक के पीता है. तो सबको, everybody has this apprehension. Is it going to be, that's the big question basically, is it going to be the COVID-2?
Right.
I think that's the worry which all of us carry.
जी, तो सर इस वायरस की ये अगर हम बात करें, क्या अवेयरनेस है अभी इसके बारे में, and how does it primarily spread in the individuals, if I may ask, because the cases that we see in Bangalore, infants and young child has that without any travel history. So any breakthrough on that?
But I would say, Pankajji, that it is only that it has been detected and now it has been published or told about that they have picked up this case. The virus has been amongst us for a long time. It was first named in US in 1958. Then became more popular in 2001 when there were some more cases were detected in US. They have the data. Actually, US is that way, is a country where you will find data on everything. So HMPV also has been happening there along with flu, along with other respiratory viruses. It's a respiratory virus, upper respiratory virus. It comes from the same family of viruses, which is COVID, flu, and many other viruses which are unnamed. Many are named. And also, it also has the same symptoms as COVID or common flu. That it will start with fever, it will start with headache, body ache, running nose, etc., cough. But it does not affect the lungs as much as COVID affected the lungs. And the illness is mild as reported in literature. In majority, I would say 99.9% individuals. Yes, as you rightly said, it is somewhere had predilection for young, very young children, like 2 years or less, or elderly. In elderly age group, particularly in those who have the immunity compromised for some reason, whether they are on cancer chemotherapy, some of them, or on dialysis, or on some other immunosuppressive medication. So I think that is where it is. And most patients, they recover without any consequence of it within 5 to 7 days. And its incubation period is also 2 to 5 days, and it is spread. Mode of spread is also basically human to human contact. If we come in contact closely, and so that is something which is very well known.
Mm-hmm.
And only thing that when we do, anybody presents in hospital with a fever,
Mm-hmm.
and when they want to investigate, they do a panel of viral serology, and
Okay.
it is included in there. So they have detected, because these families have not traveled anywhere. So
Mm-hmm.
only thing
Right.
now they have picked up, because there is awareness about it. So that is why it is
Right.
causing some concern. And but the
Okay.
only concern still will remain, as was in COVID, that
Mm-hmm.
COVID also was like that. But
Right.
whether China did some mischief in their lab to
Mm-hmm.
mutate it in a manner that it affected people more adversely. So
Mm-hmm.
if that is kind of a thing, like what we call it, the biologic warfare, so that we don't know yet. It is early days, and from
Right.
China, getting any credible information is not that easy. And
Mm-hmm.
at least this has come out, and
Right.
that's why the WHO is also concerned. That's why we are talking about it.
Right. No, absolutely. Very, important aspects you touched upon, Dr. Misra, that similar symptoms, but not so risky. And age group also, you mentioned that where, the kids, the infants, or the elderly who have lesser immunity or immunity deficiency is there. When it comes to individuals like you and me, what preventive measures can we take in general parlance, like schools and offices where there are lots of people, because there is human to human interaction also from close quarters also. What measures would you suggest that we should deploy as of now, personally?
Pankaj ji, measures are the same. They are no different than what we discussed extensively daily in COVID
COVID. Okay,
pandemic.
okay, okay, okay.
That we must mask ourselves.
Mm-hmm.
We must keep a distance if somebody has got flu-like symptoms.
Mm-hmm. Mm-hmm.
Do not go into the gatherings, large gatherings.
Okay.
So, and then we hand hygiene,
Mm-hmm.
not touching your face with the hand. So, all those preventive measures remain the same.
Mm-hmm.
But this is our behavior. Like when I travel, I don't use mask nowadays, but my wife uses it, and she is very particular about it. So I think that is where, because it is like common flu also can have clusters of cases. Sometimes we have seen that, and
Mm-hmm.
bad flu, जहाँ आपकी आवाज भी खत्म हो जाती है
Mm-hmm.
because of the bad throat or pharyngitis, so much laryngopharyngitis. So I
Mm-hmm.
think prevention is the keeping a distance, isolating individual in the family,
Mm-hmm.
and also basically not coming in contact and all that. But I don't think the same with the same strictness we'll say, like
Mm-hmm.
common flu. Uh,
Right.
we don't isolate in the manner we used to isolate in COVID.
COVID. You're right. Uh-huh. But it
Actually,
spreads
later on
just
in
like that.
COVID also that was given up. And
Mm-hmm.
subsequently in COVID also, it was not that if you remember, in the first wave in 2020,
Yes.
when there were lockdowns, etc., then we were all very concerned and apprehensive about, because we didn't know the behavior.
Right.
Uh,
Mm-hmm.
Naturally, it took some time, and then we
Mm-hmm.
came to know that somebody loses their smell, it's a mild disease. If somebody has a uh, lose motions, it's a mild disease when it involves the gastrointestinal tract. So all
Mm-hmm.
those things were there. But for HMPV, it is mentioned that it causes a mild disease.
Right.
But any viral illness in a
Mm-hmm.
given individual at extremes of age, or uh, very young children, or those who are compromised immunity,
Mm-hmm.
any viral illness can become serious.
Right.
Otherwise also.
Dr. Misra, one final question. We have the lessons from 2020 and 2021. You and your whole team, throw a lot of light on the changing patterns of COVID-19, the virus, the strain, and everything. Uh, have we learned the lessons successfully? As far as the medical team is concerned, yes, there have been upgrades, there have been certain apparatus in place to counter any situation like this in the future. as an individual, as the country as vast as India, have we learned something, or do we need to reinvent the wheel here?
No, I think we learned lot of lessons that
Mhm.
how it is important to protect oneself and others, and that's what we emphasized in COVID pandemic. Another thing which I want to tell, there is no
Mhm.
vaccine for this yet.
Yes.
For
Mhm.
HMPV, there is no vaccine as yet, and there is no treatment of the virus itself, and there is no recommended antiviral therapy for this virus. So, because it causes mild disease, so it is recommended that you bring your fever down by taking anti-fever medication like paracetamol, which is
Okay.
the safest medicine.
Mhm.
Also, take plenty of fluids and keep your nutrition, your health intact,
Mhm.
and don't get panicky about this disease. I think that's what we were telling in COVID also.
Right.
Although some people, we lost a lot of people whom we knew and a lot of others, that's a fact. But it was a pandemic. So
Mhm.
we are yet not thinking that it will turn out to be that kind of a
Right.
epidemic in China and then pandemic across the
Yes.
world, because all these cases which have been identified in India is
Mhm.
just with the viral panel they have detected this virus, which we all know that it is
Right.
there in the environment, and
Mhm.
anybody of us can catch it, and we must be catching it. One thing
Right.
is also somebody has suggested that
Mm.
maybe we have some immunity for a lot of viruses, and this
That's
may
good
be one
point.
of them. Yeah,
Okay.
so I think we have to, as we discuss those preventive measures,
Mhm.
uh, uh, take those otherwise also, because
Mhm.
we have a lot of pollution. Density of population in the country is far more than
Mhm.
Western countries. And even in China, if you go, the crowd, although their
Mhm.
population is almost equal to India,
Mhm.
we
Mhm.
now we have crossed China,
Yeah.
but you don't see those kind of a crowded places as we see in our urban India.
You
And
don't see that.
you would remember that we had the rural India did not have that worse uh,
Hmm.
COVID cases because
Mhm.
of the low density of
Yes, yes.
population.
Population was not there. Migration movement was also not that much there.
That's right.
Definitely.
So
Right.
thank you so much.
Thank you, Dr. Misra. And
You,
as always, your inputs well received here, and I'm sure that our viewers would also benefit. And you're right when it comes to this particular virus, HMPV, it has been there for sure, but the treatment as of now, not any specific thing. Prevention, I would say, and precaution is the cure.
yeah, one more thing I would add that
Yes.
don't get panicky if one case here, then two cases there, maybe more cases in Delhi and other places, because they are not, they are basically our own patients without any contact. So it is only the detection is increasing because of this China thing. That's why,
Mhm.
because there is a viral panel which
Okay.
detects this, which is a good thing in a way. So
Right.
so I would reassure that this is only detection, because this first
Okay.
case, Bangalore case, this child, this family never traveled anywhere.
Right, right,
Similarly, the other cases, also two cases which have been detected, they also have no travel history.
right.
So it is only now they are detecting this virus. So
Mhm.
let's hope that um, all those preventions at the airport and other places would help us, those
Mhm.
who are traveling. And I would say, particularly in context of Kumbh, as we were discussing about
Yes,
Kumbh
yes.
Mela,
Mhm.
that I think people who have some kind of a symptoms like flu-like symptoms should avoid going to these gatherings themselves. So
Right.
they can
Very true.
actually help a great deal to prevent the spread of flu-like viruses, whether
Mhm.
it's HMPV, whether it's
Mhm.
COVID, because COVID is also there. It's not that COVID
Very
has
much,
disappeared.
very much there. Yes, you're right.
It's very much amongst us and
Mhm.
other respiratory viruses.
Absolutely. No, sir, definitely. Thank you so much. I mean, I remember this was the time in 2020 when COVID had also started, but this one, HMPV, as you mentioned, not so scary. No need to panic also. And yes, any public gathering should be avoided, those who are symptomatic of it. Thank you so much, Dr. Misra, for
Thank
speaking
you.
to us and enlightening our viewers with the HMPV virus. Thank you.
Thank you. Thank you. Bye-bye.
Don't miss out. Log on to oneindia.com for more updates.